more educational resources, like our medical ID cards, check out medicalbasics.com.
So this is going to be a very quick video on some of the best resources for the pediatric shelf as well as the rotation. And we're going to talk about kind of just very generally, just like every other rotation or every other shelf, you need some type of question bank, some good textbooks, potentially some video lectures, as well as some other websites and resources that you can utilize while on the rotation. So the first thing is going to be a question bank. UWorld is definitely going to be king for every single rotation that you're on. So UWorld for step 2 has about 400 questions. And for some that might be enough. For other people that might not be enough questions. So I think that the next best resource and is definitely much lower in regards to how useful it's going to be. Definitely much lower yield is going to be pretest. But I would say it's probably the best question bank next to UWorld. And it has about 500 questions as well. And these are much more succinct. They're not as detailed, not as complicated, doesn't make you think as much as UWorld, but I think that it's still going to be useful, and as well as some MBMEs as well. Next thing is going to be different textbooks. So case files is going to be a great resource. And I think personally, this is probably the best resource for the pediatric shelf. It honestly felt like the pediatric shelf was probably the easiest shelf of the bunch. But everybody's different and everybody finds each of the different shelves differently. But personally, I felt that I didn't need to read as much as I did in other shelves. For example, surgery, I had to read a lot more. Medicine, I had to read a lot more and do a lot more questions. Whereas in pediatrics, I felt like I was a little bit more comfortable with doing a little bit less. And so I did all of the question banks that I mentioned before. And then the one book that I used was Case Files. So it's a book that kind of walks through all the different cases. There is the common case, I think about 50 to 60 cases, and gives you some good practical questions, about 5 or 6 per case, and really just walks through what is the different approaches. So it's very good for, I think, one of the hardest things in medical school for any specialty is that what is your approach? People always will ask you what your approach is, but also you'll ask yourself, how do you think about different problems? How do you think about a baby, a newborn with a fever? How do you think about not so much of a baby, but just like an adolescent or even a 2-year-old with abdominal pain or vomiting, things like that? How do you approach those types of situations? I think that Case Files does a very good job of that, of giving you those very broad overviews for every single specialty, and pediatrics is no different. BRS for pediatrics is also a good overview book. It reads more a textbook would read rather than Case Files is more case-based. So it's a good book if you need for a reference. I personally don't like reading that much. I don't like reading very detailed. If there was a certain subject I felt like I need to know more about, this was something that I could reference. It was more detailed and can give me that greater knowledge that I desired for that particular subject. But I didn't want something that I had to read every single aspect of pediatrics in that much detail. So BRS is much more detailed, in my opinion, than Case Files. And then you have other things like Master of the Boards, First Aid for Step 2, that give you a good broad overview. And I think those were extremely helpful for pediatrics because I just wanted a general overview on the subject itself. Next thing are going to be video lectures, pretty similar to other shelves. Online MedEd, Sketchy Medical, and Picmonic are going to be my top picks. Online MedEd essentially just walks you through the different subjects within pediatrics as well as other subjects as well. So surgery, medicine, pretty much all aspects of your medical school career. And it'll walk you through the main problems of pediatrics, give you some good approaches as well. And Sketchy Medical and Picmonic really just use those for pharmacology. If you've used those before for step 1, they give you a good way to memorize different drugs for your shelf. But you'll notice that these shelves don't focus on pharmacology as much as, definitely nowhere near as much as step 1, and definitely a lot less than you would in step 2. Next thing is going to be some resource on the ward. So Pocket Medicine is going to be a great book in whatever rotation that you're on. Good to just have these approaches that you can trust and also that you can reference on the go. Scrub Notes is something that we made that I think is really useful because I don't know anybody who can memorize pediatric vital signs or pediatric lab values or immunizations, because I could not memorize those at all. And I think that make it so that you don't have to memorize. You can just reference it at a card that you can put on the back of your ID badge. So great for just being able to memorize certain things. Next thing is going to be different websites that you can utilize on the wards or also at home while you're studying. So Emma Holiday, mentioned this before for other shelves, can utilize this as a review course right before your shelf. One of the University of Texas schools at San Antonio had made a bunch of different lectures for psychiatry, pediatric surgery, and internal medicine. And these were just review courses that she developed for the third years there. Clip cases, this is going to be a unique one. So clip cases was something that was offered and actually a requirement at my institution that I trained at. I thought they were actually extremely useful. Very similar to case files in my opinion, where they were these online modules and cases that walked you through the major diseases. And something that you can definitely utilize, had a lot of questions built into them as well. So if you have access to it, definitely I would use these. If you don't have access, I would never pay for it. But it's definitely something that you can utilize and it's very useful and you should take it seriously if you do have access by your school. Up-to-date Hippocrates and Micromedics, just good for having general approaches with up to date, have something to reference on the go. Definitely should not be using Wikipedia, should not just be Googling random details while you're on rotations. And then Hippocrates and Micromedics is really for dosing and frequency of medications. And that's a very quick overview for the pediatric shelf and rotation. Definitely, it's going to be something that you're going to have to do very similarly to other rotations. And it's going to be one of the core rotations that you want to do well in. So definitely don't take this one too lightly.
Be sure to check out our website, medicalbasics.com, for more educational resources like our progress notebook, and don't forget to subscribe to our channel for more tips and lessons.